Every single morning, millions of Americans over 60 do something that is quietly destroying their voice, and they have absolutely no idea it's happening. It is not smoking. It is not yelling. It is something most people drink every single morning before they even get out of bed. And we will get to exactly what that is in just a few minutes. But first, I need to share something with you that honestly stopped me in my tracks. 89% of people living with Parkinson's disease will experience significant voice loss within just 5 years of their diagnosis. 89%. And yet, most doctors never sit down and warn their patients that this is coming. They talk about tremors, they talk about balance and medication, but the voice, it almost never comes up in those appointments. And by the time most people notice something has changed, months or even years have already gone by without any action taken.
So, let me ask you something directly. Has your voice gotten quieter lately? Do people ask you to repeat yourself more often than they used to? Do you ever feel like you are talking at full volume, but the person right in front of you still leans in and says, "Sorry, what did you say?" If any of that sounds familiar, I want you to stay with me. Because in this video, I am going to walk you through a simple 7-minute morning protocol backed by over 30 years of clinical research that can genuinely help protect and strengthen your voice. You can do it at home, no equipment needed, starting tomorrow morning. And I promise you, by the end of this video, you will understand your voice and what is happening to it better than you ever have before. To understand why this happens, we need to talk briefly about what Parkinson's actually does to your body. And I will keep this simple, I promise. Parkinson's disease causes a gradual loss of dopamine in the brain. Now, most people know dopamine as the feel-good chemical, but dopamine does a lot more than that. It is the messenger that tells your muscles how hard to work, how far to move, and how much effort to put in. It is the signal that says louder, stronger, more. When that signal weakens, everything it controls weakens with it. When dopamine drops, the muscles in your larynx, that is your voice box, begin to weaken. The movements become smaller, softer, slower. And here is the part that really surprises most people. Your brain does not realize this is happening. Your brain genuinely believes you are speaking at a normal, full volume. But the signal it is sending is not strong enough anymore. So what you think is a loud, clear voice comes out as a whisper. And this typically progresses in 3 recognizable stages. In the first stage, the voice becomes noticeably softer. People start having trouble hearing you in noisy places or over the phone. You might notice you are straining more to be heard at the dinner table, or that people keep turning up the TV volume when you are trying to have a conversation. In the second stage, speech begins to slur a little. Words run together. Sentences become harder to follow. People may start misunderstanding what you say, or finishing your sentences for you, which, even when it comes from a good place, can feel deeply frustrating. By the third stage, the voice may become so quiet or unclear that communication becomes genuinely difficult. Some people at this stage begin avoiding conversations altogether, which only makes things worse over time. And there is one more thing I need to mention here, something that does not get talked about nearly enough. The same muscles that control your voice also control swallowing. So as voice problems get worse, swallowing can become harder too. Food or liquid may go down the wrong way more often. Meals can start to feel like a source of anxiety rather than enjoyment. That is a serious concern,
And it is one more reason why protecting your voice early matters so much. Because you're not just protecting your ability to speak, you're protecting your ability to eat safely and comfortably as well.
Drop a comment below and let me know. Had you ever heard this connection between Parkinson's and voice loss before? I am always curious to hear from you. But here is what your doctor probably did not tell you. Voice loss from Parkinson's is not just an inconvenience. It is not just embarrassing or frustrating. According to research from the Mayo Clinic, voice loss leads to social isolation, and social isolation leads to depression. And depression in people with Parkinson's can accelerate cognitive decline by as much as 40% faster. Let that sink in for a moment. Losing your voice does not just affect how you communicate, it can affect how quickly your mind changes. When people cannot be heard, they stop trying. They stop going to family dinners. They stop calling friends. They stop participating in the conversations that keep the mind sharp and the spirit alive. And that withdrawal, quiet and gradual as it is, becomes one of the most dangerous things that can happen to someone living with Parkinson's. The voice is not just a physical tool. It is how we stay connected to the people we love. It is how we stay present in our own lives. I want to share a story with you, and this is a story I think about often. There was a gentleman in his early 70s living alone with Parkinson's. His voice had been getting softer for a couple of years, but he figured it was just part of getting older. One evening, he fell at home and needed help. He reached for his phone and dialed emergency services. But when the operator answered, they could not hear him well enough to understand what he was saying or where he was. He was not found for hours. Now, I am not sharing that to frighten you. I am sharing it because your voice is not just about conversation. It is about safety. It is about independence. It is about being able to speak up for yourself when it matters most. The good news is this. Voice loss from Parkinson's is one of the very few symptoms that can actually improve with the right kind of practice. Unlike some of the physical changes that come with Parkinson's, your voice responds to training. Scientists and speech therapists have spent over 30 years studying this, and what they discovered changed the way we think about voice therapy for Parkinson's patients forever. The therapy is called the Lee-Silverman Voice Treatment, or LSVT Loud for short. And clinical studies have shown it produces meaningful improvement in voice strength and clarity in up to 89% of patients who use it consistently. Think about that number for a second. Nearly 9 out of 10 people who commit to this approach see real, measurable results. That is not a small thing. That is genuinely remarkable for any neurological condition.
Here is what makes it different from anything you might have tried before. LSVT Loud does not just exercise your vocal cords, it actually retrains your brain. Remember what I said earlier? That the Parkinson's brain thinks it is speaking loudly, but it is really whispering? This therapy works by deliberately practicing speaking at a louder volume over and over again. And over time, this recalibrates the brain's internal sense of what normal volume actually feels like. The brain gradually learns to send a stronger signal, and the voice responds. Think of it like recalibrating a thermostat that has been set too low for years. The house has been cold, but the thermostat thinks everything is fine. You have to manually reset it, and then hold it there long enough for the system to accept the new setting as normal. That is exactly what consistent, loud voice practice does for the Parkinson's brain. Now, the full formal version of this therapy is done with a certified speech-language pathologist over several weeks. And if you have not spoken to one yet, I am going to talk about when you should make that appointment before this video is over. But the wonderful thing is that the core principles, speaking loudly, intentionally, every day, are something you can start practicing on your own, right now, with zero equipment. And that brings us to the heart of this video,
the 7-minute morning voice protocol.
Picture this. It is 7 o'clock in the morning. The coffee is brewing, and before you do anything else, you give your voice exactly 7 minutes of attention. That is it. 7 minutes. That is less time than it takes to read the morning news. Here is exactly what to do. First, the sustained ah, 2 minutes. Take a comfortable breath in, not a gasp, just a nice, easy breath. Then open your mouth wide and say ah as loudly as you comfortably can, and hold it for a full 15 seconds. Really push for that volume. It should feel almost uncomfortable, like you are genuinely trying to be heard across a room. Rest for about 5 seconds, take another breath, and do it again. You will repeat this for 2 full minutes. The goal here is to recalibrate your brain's volume perception. You are essentially telling your nervous system, this is what loud feels like. This is the new normal. Second, loud counting, 2 minutes. Count out loud from 1 to 10, but do not count at your normal conversational volume. Count louder than feels natural. Count each number clearly and separately. 1, 2, 3, giving each one its own moment. Emphasize the consonants. Make each number land. After you reach 10, start back at 1 and do it again. Keep going for 2 minutes. This exercise bridges the gap between sustained sound and actual speech. It gets your lips, tongue, and jaw working in coordination with your voice.
Third, reading aloud, 3 minutes. Grab anything. A newspaper, a magazine, a book, even a grocery list. Open your mouth wider than you normally would when you speak. Read out loud, at the same volume you use during the counting exercise. You are not just reading here. You are integrating breath support, vocal strength, and clear articulation all at the same time. One small tip that makes a big difference: sit up straight while you do this. Good posture opens up your airway and gives your lungs more room to support your voice. Slouching compresses everything and makes it harder to project sound. 3 minutes of this every morning makes a real difference. Not because any single session is dramatic, but because your brain responds to repetition. You are building a new habit at the neurological level. And the best part is, after just a few weeks of doing this consistently, many people report that their conversational voice starts to feel stronger too, even when they are not trying. Have you tried any kind of voice exercises before? Let me know in the comments. I read every single one. Before we continue, there is something you drink every morning that is silently destroying your voice. And I know that might sound dramatic, but hear me out. Caffeine. Your morning coffee or tea, the very thing most of us reach for before anything else, is a diuretic. That means it pulls moisture out of your body, including out of the thin layer of fluid that keeps your vocal cords soft and flexible. Dry vocal cords vibrate poorly. They tire out faster. They become more vulnerable to strain. Now, I am not saying you need to give up your coffee entirely, but try doing your 7-minute voice protocol before that first cup. And always drink a full glass of plain warm water first.
There are 2 other things to be aware of. Dairy products, milk, cheese, yogurt, consumed right before you need to speak can cause your body to produce excess mucus. For some people, this thickens the coating around the vocal cords and makes the voice sound foggy or strained. It is best to avoid dairy for about an hour before any time you plan to speak a lot.
And certain over-the-counter allergy medications, the kind that dry up a runny nose, can also dry out your vocal cords significantly. If you take allergy medication regularly, it is absolutely worth mentioning to your doctor and asking whether the type you are using might be affecting your voice. Now let's talk about what actually helps. Warm water with a spoonful of honey is genuinely one of the best things you can do for your vocal cords. The warm water hydrates, and honey has natural soothing properties that protect the delicate tissue of your throat. I personally recommend making this your very first drink of the day. Before the coffee, before anything else. Just a mug of warm water with honey. It takes 30 seconds to make, and it sets your vocal cords up for the whole morning. Turmeric and ginger are both powerful anti-inflammatory foods, and inflammation in the throat is one of the hidden factors that can make voice problems worse. Adding these to warm water or to your meals is a simple, gentle way to support your vocal health from the inside. You can find turmeric and ginger at any grocery store, and they are inexpensive. Small habits like this, done consistently, add up in ways that are hard to see day to day, but very real over time. And water. Plain, ordinary water. Aim for 8 full glasses every single day. Your vocal cords need hydration constantly, not just when you feel thirsty. By the time you feel thirsty, your cords are already on their way to being dry.
What about you? Are you drinking enough water each day? A lot of people are surprised to realize they are not. Let me know in the comments. And here is something you can do right now in your morning shower. Sing in the shower. I am completely serious. Singing uses the same brain-to-muscle pathways as speech, but in a way that feels natural and enjoyable rather than clinical. The warm, humid air from the shower is also perfect for your vocal cords. The steam hydrates them while you practice. You do not need to be a good singer. You do not need to hit the right notes. Just open your mouth, breathe well, and let sound come out. Old songs you know by heart are perfect. Your brain does not have to work as hard to remember the words, so it can focus on the act of producing sound. Another wonderful habit is humming. Humming gently activates the resonance in your chest and head, warming up the full vocal system without putting any strain on the cords themselves. Try humming a simple tune while you are making breakfast or getting dressed. It takes no effort, and it keeps your voice active and engaged throughout the day. Some people find it helpful to hum while they walk, and walking itself is one of the best things you can do for Parkinson's overall, so that is a 2-for-1 right there. Here is one more that might surprise you. Start making phone calls again instead of sending text messages. I know texting is easier. I know it feels more convenient, but your voice operates on a very simple principle. Use it or lose it. Every phone conversation you have is a genuine workout for your vocal cords and for your brain's communication pathways. Call a friend instead of texting. Call your grandchild. Call your neighbor. Read a recipe out loud while you cook. Talk to your pet. It truly does not matter what you say. What matters is that you are using your voice out loud every single day. Every single conversation strengthens the connection between your brain and your voice. Now, and this is important, all of these home practices are wonderful, and they genuinely help. But there are certain signs that mean it is time to get in front of a speech-language pathologist right away. You should make that appointment if your voice has changed noticeably in the past few months and does not seem to be getting better. You should go if you are starting to have any difficulty swallowing, even occasionally. You should go if people can no longer understand you on the phone, or if you are avoiding social situations because speaking has become too difficult or exhausting. You should also go if you find yourself speaking less and less throughout the day, not because you have nothing to say, but because the effort it takes has simply become too great. That withdrawal is a warning sign. and it deserves professional attention. A speech-language pathologist who specializes in Parkinson's can do a proper assessment, work with you on the full formal protocol, and customize a plan for exactly where you are right now. They can also check your swallowing function and catch any early problems before they become dangerous. Home exercises are a powerful supplement, but they are not a replacement for professional care when you need it. Think of everything I have shared today as a bridge, something to start with right now while you are working on getting that professional support in place. Is there a speech therapist currently on your care team? If not, today might be the day to ask your neurologist for a referral. It could make a bigger difference than almost anything else you do.
All right, let's bring this all together. We know that Parkinson's disease gradually weakens the connection between your brain and your vocal cords. We know that the brain starts to misjudge its own volume, and that without intervention, the voice quietly fades. We know that this matters far more than just being heard in a conversation. It affects your safety, your independence, your mental health, and even how fast your mind changes over time. And we know, and this is the part I really want you to hold on to, that this is one of the few Parkinson's symptoms where you can actually push back. You have real tools. You have real options. And the earlier you start, the more you have to work with. Your voice is worth fighting for. And 7 minutes a day is not a big ask for something that important. So here is your 7-minute morning protocol. One more time. Start with 2 minutes of sustained ah. Open your mouth wide, breathe in, and hold that ah as loud as you can for 15 seconds at a time. Then move into 2 minutes of loud counting. Count from 1 to 10, louder than feels comfortable, crisp and clear. Then finish with 3 minutes of reading aloud, anything at all, with your mouth open wider than normal, at that same strong, intentional volume. 7 minutes, every morning. That is all. And remember, avoid caffeine and dairy before your practice. Drink warm water with honey first. Stay hydrated all day. Sing in the shower. Hum while you go about your morning. And call someone you love instead of sending a text.
Now, I want to ask you one honest question. Can you give 7 minutes each morning to protect your voice, your independence, your ability to be heard when it matters most? I believe you can. And I believe it is worth it. I also want to say this. If you are watching this video, not for yourself, but because someone you love has Parkinson's, thank you. The fact that you are here, learning, looking for ways to help, that matters more than you probably realize. Share this video with them. Do the morning protocol together if you can. Having a partner makes it easier to stay consistent, and it turns a clinical exercise into something that actually feels good to do each day. If this video helped you or someone you love, please hit the subscribe button so you do not miss what is coming next. Because in our next video, we are going to talk about the early warning signs that Parkinson's is progressing faster than your doctor may realize, and what you can do right now to slow that down. Leave a comment below and tell me, which part of today's video surprised you the most? I genuinely read every comment, and your questions help me decide what to cover next. Take care of yourself, take care of your voice, and I will see you in the next one.